Hi, good evening, everyone. Thank you for joining me. I am just updating you again about STORM, Spike Triggered Autoimmune Response Mechanism. This is an acronym that I've created. This is a piece of research that I am doing in anticipation for what is to come. What a lot of people don't realize is that I've been looking at this for a number of years. So I've been seeing it for some time, just not in the numbers and the extent that I think it's going to happen very soon. So this is a very important conversation. And what I'd like you to remember is that this concept is a call to action for the scientific community, in that what we need to do is we need to reflect carefully on the characteristics of disease that we are seeing. The mistake that many people are making is that they are not realizing that COVID has transitioned. So you don't see as much respiratory disease. You still see respiratory disease, but it just looks like a chest infection. But what we're seeing is a whole raft of unusual patterns, clinical patterns, that we need to try and make sense of, and we need to try and understand the mechanism. So, what I'm doing here is making you aware of what is coming soon. So, here, what I want you to do is I want you to look in the description and join us in this webinar. So, this is coming up on Thursday, the 8th of August. If it is beyond that date, you will see a link to be able to see the full course. It's going to become a course. And what I'm trying to see if I can do with regards to this is answer the questions that a number of people have been asking me. When I did the presentation, and there is a link to this course here, just so that you can see it in case you want to look at it, it's important to understand what I was looking at with regards to the storm. I was looking at the overview of this response mechanism, IgG4 and viral sepsis, macrophage activation, blood tests, increased risk after immune priming, and pathological outcomes. So that already is quite comprehensive. And what will be added to it is this question about therapy, because that's what people were asking me at the time. Well, if this is occurring, what do we do about it? Truthfully, I hadn't thought that far. My focus had been primarily on characterizing the disease, characterizing the pathology of the disease, trying to put that forward. And this is what will come in this storm white paper. And so, what we have here now is a challenge as to what exactly is occurring in terms of this spike triggered autoimmune response mechanism. Why is it occurring more frequently now? And what options do people have that are available to them? Because part of the trouble is that this is so far ahead with regards to the science, is that you won't hear anybody talking about it. So if you mention this, people will go, "What are you talking about?" It would mean you're one of the few people who actually knows about this concept. And so, again, if you are interested in terms of trying to get a better understanding as to what I was doing, please look at the link in the description to get to the course. What I wanted to show you quickly is I just wanted to show you a little bit more about what I'm thinking of and how it will direct what I think the therapy should be. So, the first challenge to recognize is this issue about upper airway mucosal protection. This represents the upper airway, and you can see this is to be the virus that is going to go into the nasopharynx. It will infect the region around here, replicate, and continue to spread down into the lungs. This is what happens with the Omicron variety. One important thing is that Omicron has a predilection for entering the sinuses, and it's far more efficient at it. And so this is part of the reason why I've had this principle of getting people to know about nitric oxide. And so it gives me a chance to remind you, if you want to learn about nitric oxide, the power of no, go to the landing page here, join us in the newsletter. It is absolutely free. Just put in your email and you'll be given a link to get the power of no, because we're looking at protecting the upper airway, especially the sinuses, from this infection that can lead to long term issues. So that's really what we're about with regards to that. So, getting back to the presentation here, what we have and what I was focused on is the fact that if you have adequate protection here, the virus can't break this mucosal barrier. This is what this is supposed to represent, with the white here representing IgA antibodies. So you're not supposed to break through this mucosal barrier, even if somebody has an infection. If, however, the virus breaks into the lymph nodes and bloodstream, you'll get a systemic immune response. This is the bit that I'm worried about with regards to storm, because based on the research, it was primarily about autoimmunity that our initial research was showing, which fits with the patterns that we're seeing today. These represent antibodies and autoantibodies, so not just antibodies against the virus, but autoantibodies targeting normal proteins. So the challenge is, one, don't get the virus beyond this. That's the first challenge. So you don't get the infection going into the bloodstream. Then it is, if it does get into the bloodstream, what can we do in order to try and mitigate the impact of it? One important thing about Omicron, different from the earlier variants, and this is showing you a paper. So this paper was from Yoon Soon Ho, and this was from 2023, and they were looking at CT chest findings in patients with SARS-CoV-2 Delta versus Omicron. And what you're looking at, where you see red, is that it represents high concentration of viral infection with inflammation. In the Delta variant, this is why we had such severe lung disease. You can see how much of the lung was involved. This is the left and the right lungs. You can see how much of the lung was involved in terms of causing inflammation, which is why it caused such significant disease. But when we look at Omicron, most of the inflammation is in the upper part, in the bronchioles. This is why people end up with this chronic cough. You still have some red down here, but it's nowhere near as severe as in the Delta variant. So, this is part of the reason why people didn't die of severe COVID 19 as often as they did with Delta. But the fact that you have inflammation in this region doesn't preclude the reality that you have viral sepsis. So the virus will still infect that region and then cause and spread to in the bloodstream. This is where you get this issue of viral sepsis. That's the bit that I'm very concerned about. And the virus gets into the bloodstream here, this is virus here. It infects endothelial cells, then it replicates, more of it gets in. And so you have this then circulation where it's going through all the organs, and it can be very subtle. Based on clinical observation, and I quiz patients about this to try and understand the patterns, it seems that their characteristic symptoms initially start with fatigue, and they feel very fatigued. They usually know they have had a viral exposure, but they oftentimes don't have many other symptoms. And this is really concerning because it's then very difficult to know what is the cause of the symptoms. But the observation I've seen is that they feel very fatigued. One of the more recent observations is nausea, which is unusual, and it suggests that there's GI involvement. So that means the virus is getting to the gut. So they get quite nauseous, feel unwell, sometimes headaches. That could represent the issue with regards to sinuses, and this can last for weeks. And so when I think about what happens with patients, is that they oftentimes feel unwell for a long period of time. This is very, very difficult to therefore pick up, because by the time you see them, they are negative for infection. This here is where I think the focus of attention is, and this is what I've been focused on, is that actually what we're seeing in terms of the disease manifestations are infections of these macrophages becoming activated and also being targeted by autoantibodies. And this was what happened, we think, in early COVID, which from day 15 onwards, you had this massive interleukin 6 release, did quite a bit of damage to the lungs and an inflammatory process. But this, in my view, is still occurring. It's just at a much lower level. And part of what we were looking at was what were the manifestations, the blood manifestations. Again, that's part of the course that would help us to be able to clarify that in more detail. So, part of this whole process is if we understand what happens, and this is the presentation that I think would occur in terms of severe lung disease. So this is what would have happened early on, is that when the virus gets down into the lungs, this represents an alveolus. This is the blood vessel going past with oxygen, well, carbon dioxide released, picks up oxygen. So this whole area, when it becomes inflamed with the virus, starts to pull in lots of blood cells, white blood cells, monocytes, neutrophils, eosinophils, and then it ends up like this. So this inflammatory process goes on. Then you have this critical cytokine storm occurring with regards to these monocytes. These are monocytes, immature monocytes that come in, they get infected by the virus as well. This represents a mast cell releasing histamine, and this could be part of the reason why antihistamines are very effective. And this here is a plasmacytoid dendritic cell, which produces massive amounts of interferon on infection. And this is what it seems to occur in early COVID severe disease. And this is what we were looking at from our research. So when we look at that, and when I focus on the fact that it seems that these macrophages are central to what is occurring, and this is the challenge, these macrophages seem to be central, and the virus can infect these macrophages. It can't replicate in them, but it seems to activate them, and they don't die. And so, what we're seeing is a chronic inflammatory process that seems to be occurring in patients. And that's what I call the COVID storm. It's a chronic process that is going on, and it presents in a different way. It's not typical of the severe lung disease, and it makes it harder for us to pick up what's going on. You really have to be looking for it in order to see it. And that's part of the challenge, is that I want clinicians challenge the ideas, because I want you to think about what it could be. If I'm not right, what is right? But there is some very strange patterns that are going on. So when I talk about the therapy, and this is why again I'm encouraging you, join me for the webinar, which will be coming up. So when I speak about the therapy, I'll be looking and trying to figure out how can we stabilize this immune system? How can we do it preemptively, where the immune system is more stable even if viral sepsis occurs? And if viral sepsis occurs, what can be done to try and mitigate that immune damage that can occur over a long period of time? It's very complicated, I must admit. It's not easy to try and work out the best way, but I'm taking the best shot at looking at the pathology, anticipating the characteristics of the disease, and trying to put together a framework that can work for the general public. Because, as I said before, from a clinical point of view, if you were to say this to your doctor, they'd never have heard of this. This is a new concept. And so part of my challenge is pushing it out to the scientific community, getting them to reflect on it. But it takes a long time for protocols and therapists to get front line. What you'll be getting is me anticipating the issue and saying, okay, based on what we understand about the pathophysiology, here is what I think you can do. This is how you can try and manage and mitigate some of the characteristics that could occur for you and your loved ones. So that's really a big challenge with regards to the therapy. And it was because people were asking me when I was doing the presentation. And again, I remind you that if you want to see the presentation here, It's available here. I've put it together as a course. It's discounted. Both parts will be added, which is not just the first part, but also the therapy, and give you a framework for you to understand what is going on. We need solutions, and I'm doing my best to try and see if I can put it together in a way that you can utilize the science using simple strategies that are available to you to help to try and mitigate a very complex phase of the pandemic that is coming towards us. There are no easy ways out of this. That's the reality. We all have to try and find the best way forward. My aim here is to try and apply the science and use simple, effective strategies. And again, I mentioned to you one of the most simple and most effective strategies is nitric oxide. It protects your upper airways, makes it harder for the virus to infect, and protects you generally. So remember to subscribe. Join us as well with regards to the webinar on Thursday, the 8th of August. If it's beyond that, look out, because the course will be there, and this course will be there. It's at a discount now. Join us, and both parts will eventually be here in the near future. So thank you very much for joining me, and look forward to bringing you more information in the near future.